2023 Practice CNA Exam Questions and Answers Managing Emergencies. Question number 1. The first aid treatment for hemorrhage is to A. Put on a tourniquet. B. Run and get the nurse. C. Lower the arm below heart level. D. Apply direct pressure. The correct answer is D. Do not leave the resident. Exert direct pressure on the wound with a sterile bandage or clean cloth while calling for the nurse. Question number 2. While eating dinner, a client starts to choke and turn blue. The nurse aide should immediately A. Remove the client's food tray and go find the nurse in charge. B. Give the client a drink of water. C. Call for assistance and perform the Heimlich maneuver. D. Slap the client on the back until the food dislodges. The correct answer is C. The Heimlich maneuver, also referred to as abdominal thrusts, is the best response to choking. Calling for assistance as you prepare to do abdominal thrusts will alert others to the emergency. To perform abdominal thrusts, stand behind the client and use your hands to exert upward pressure on the bottom of the diaphragm. Question number 3. Which of the following is the most comfortable position for a client with a respiratory problem? A. Lateral. B. Supine. C. Fowler's. D. Prone. The correct answer is C. When a client is having difficulty breathing, the Fowler's position can provide relief. When sitting in the high Fowler's position, the client is upright at 90 degrees, allowing the chest to expand as much as possible. Prone, on the abdomen, supine, on the back, and lateral, on the side, are all flat positions, which can make respiratory distress worse. Question number 4. The nurse aide finds an unconscious client lying in bed. The first thing the nurse aide should do is A. Call for help and stay with the client. B. Check the client for signs of injury. C. Offer the client a drink of water. D. Help the client into a sitting position. The correct answer is A. If you encounter any type of emergency situation, such as finding an unconscious client, always call for help first and be prepared to perform CPR if the client is pulseless. Question number 5. Which type of fire can be put out with water? A. Electrical. B. Paper. C. Grease. D. Chemical. The correct answer is B. Never use water on an electrical, grease, or chemical fire because of the risk of electric shock or the potential of spreading the fire. Question number 6. A resident seems short of breath. He tells you that his chest hurts. You should A. Immediately notify the nurse. B. Assess the resident for a possible lung infection. C. Tell him that he most likely has gas pains. D. Start CPR. The correct answer is A. The nurse aide should notify the nurse of a resident's complaints. She should also check the resident's vital signs and remain with the resident. The nurse will complete the patient assessment, not the nursing assistant. The nurse will notify the patient's physician of her assessment findings. In this questions, the patient is breathing and talking to you. Therefore, he does not need CPR. Question number 7. The nursing care plan states, transfer with mechanical lift. However, the client is very agitated. To transfer the client, the nurse aide should A. Lift the client without the mechanical device. B. Keep the wheels unlocked so the lift can move with the client. C. Get assistance to move the client. D. Place the client in the lift. The correct answer is C. Do not try to accomplish a task alone if a patient is unable to cooperate for any reason. Ask a coworker to help if you have any concerns about keeping the client safe. If the client remains agitated, notify the nurse before proceeding. Question number 8. The patient is scheduled to have surgery. The diet order states, N.P.O. What does that mean? A. Nothing by mouth. B. Nothing per stoma. C. Nothing by mouth except water. D. Only ice chips by mouth. The correct answer is A. N.P.O. is a common medical term that means the client cannot eat or drink anything, including water or ice chips. A doctor may order a patient to be N.P.O. before surgery, before a diagnostic test, or if a patient has a gastrointestinal condition. Question number 9. A patient who has a history of dizziness has an order for shower privileges. The nurse aide should A. Take care of the patient's roommate while the patient showers. B. Sit the patient in a shower chair and remain nearby. C. Start another patient's shower, to save time. D. get the patient started, then leave to respect their privacy. The correct answer is B. If there is any doubt about a patient's ability to maintain balance, use a shower chair or speak with your nurse. Sitting in a shower chair helps keep the patient safe while showering. Also, remaining nearby will allow the nurse aide to quickly assist the patient if he becomes dizzy while showering. Question number 10. The equipment you need for oral care of an unconscious client includes A. Either a toothette or mouth swab. B. Mouthwash or toothpaste. C. Suction equipment, if available. D. All of the above. The correct answer is D. Because an unconscious client is not able to assist with oral care, you must take extra precautions to prevent the client from choking or aspirating. The client's head should be turned to the side. If possible, lower the head of the bed. Gently clean the teeth and gums with a moist toothette or mouth swab. When you've finished, wipe the client's mouth and raise the head of the bed to its previous position. Question number 11. While making an empty bed, the nurse aide sees that the side rail is broken. The nurse aide should A. Report the broken side rail immediately. B. Wait for the next safety check to report the broken side rail. C. Warn the client to be careful when he or she gets back into bed. D. Tie the side rail in the raised position until it is fixed. The correct answer is A. Report the broken side rail immediately. Never use broken equipment or try to create a temporary fix for equipment that is not working properly. Replace the bed immediately with one that has functioning side rails. Question number 12. The purpose of padding side rails on the client's bed is to A. Have a place to connect the call signal. B. Protect the client from injury. C. Keep the client warm. D. Use them as a restraint. The correct answer is B. If the client is agitated, confused, or has a head injury or a history of seizures, padding the side rails can prevent injuries or entrapment. Some facilities have bed rail pads or bumpers in stock that are required for patients on seizure precautions. Question number 13. If the nurse aide discovers fire in a client's room, the first thing to do is A. Remove the client. B. Try to put out the fire. C. Call the nurse in charge. D. Open a window. The correct answer is A. Whenever there is a fire, remember, RACE. R equals rescue, remove all people in immediate danger. A equals alert others and pull the fire alarm, if it has not already been done. C equals confine, contain the fire or smoke by closing doors to prevent or slow the spread. E equals extinguish the fire if possible, using a handheld fire extinguisher. Only try to extinguish small fires and only as long as you can remain safe and have an escape route. Question number 14. The Heimlich maneuver is used on a client who has A. Seizures. B. A blocked airway. C. Impaired eyesight. D. Fallen out of bed. The correct answer is B. The Heimlich maneuver, or abdominal thrusts, is a first aid technique for helping someone who has an object caught in his or her upper airway. Question number 15. What is the first thing a nurse aide should do after finding an unresponsive client? A. Close the door. B. Call the client's family. C. Call for help. D. Start compressions. The correct answer is C. When encountering any type of emergency situation such as an unconscious client, always call for help first. Others within the healthcare team can assess the patient and provide advanced emergency care. In this question, the patient is unconscious, not pulseless. Therefore, chest compressions are not warranted. Question number 16. To avoid pulling on the catheter while you're turning a male client, the catheter tube must be A. Taped to his bedsheet. B. Upper thigh. C. Bed frame. D. Hip. The correct answer is B. The catheter should be attached to the client's upper thigh with tape or a fastening device to prevent pulling. The drainage bag should remain lower than the client's bladder to prevent a backflow of urine. Question number 17. Which of the following people provide treatment for persons who have difficulty talking due to disorders such as a stroke or physical defects? A. Registered nurse. B. Physical therapist. C. Speech therapist. D. Occupational therapist. The correct answer is C. If a client is unable to speak clearly or has trouble forming words, a speech therapist can treat speech problems caused by strokes, physical defects, or swallowing disorders. Question number 18. Factors that increase a resident's risk of falling include the use of A. Medications, B. Sensory problems, C. Muscle weakness, D. All of the above. The correct answer is D. As people age, their physical and medical conditions can increase the risk of falling. Muscle weakness, especially in the legs, is one of the most important risk factors. Medications and their side effects can cause dizziness or confusion. Sensory problems, such as numbness in the feet or foot pain, increase the risk of falls. Other risk factors include poor vision, balance problems, and slow reflexes. Question number 19. What sudden illness is usually caused by a blockage of blood flow to the brain? A. Diabetic emergency. B. Heat-related illness. C. Heart attack. D. Stroke. The correct answer is D. A stroke occurs when a blood vessel in the brain becomes blocked or narrowed, or when a blood vessel bursts and spills blood into the brain. Just like a heart attack, a stroke requires immediate medical attention. Question number 20. A home care client is having trouble breathing. Based on your check of the person, you suspect that she is having a severe allergic reaction. What should you do? A. Call the home care agency and ask to speak with the nurse. B. Call 911 immediately and care for the person until advanced personnel take over. C. Give the person a cool drink. D. Give the person abdominal thrusts. The correct answer is B. Call 911 immediately. Anaphylaxis is a severe, potentially life-threatening allergic reaction. It can occur within seconds or minutes of exposure to allergens, such as peanuts or bee stings. If the client has an epinephrine pen, assist her to use it while waiting on the arrival of the emergency medical services. You can notify the home care agency after the client is stabilized. Question number 21. When caring for a home care client who is having a seizure on the floor, you should A. Place a spoon or wallet between the person's teeth. B. Remove nearby objects that might cause injury. C. Try to hold the person still. D. All of the above. The correct answer is B. While calling 911, remove any objects that could injure the client. Document the time that the suspected seizure activity started and ended. Place the client in the recovery position after the seizure has ended. Also, notify the home care agency once it is safe to do so. Question number 22. This sudden illness results from too much or too little sugar in the person's blood. What is it? A. Allergic reaction. B. Diabetic emergency / seizure. D. Stroke. The correct answer is B. A diabetic emergency, where a person passes out due to extremely low or high blood sugar, is an emergency that requires immediate medical attention. To prevent diabetic emergencies, most diabetic patients need their blood sugar levels checked before meals and at bedtime. Also, a diabetic emergency can be triggered by skipping meals, over-exercising, drinking alcohol, or taking too much insulin. Question number 23. In stroke recognition, FAST stands for A. Face, arm, speech and time. B. Feet, airway, speech, and temperature. C. Fever, anxiety, stress and taste. D. Flexibility, asthma and sudden tightness in the chest. The correct answer is A. FAST is an acronym used for recognizing and responding to the sudden warning signs of stroke. The letters stand for F equals face dropping. Ask the person to smile. Does one side of the face droop or is it numb? A equals arm weakness. Ask the person to raise both arms. Is one arm weak or numb, or does one arm drift downward? S equals speech difficulty. Ask the person to repeat a simple sentence, like, the sky is blue. Is the speech slurred? T equals time to call emergency response so that the patient can receive emergency treatment. Question number 24. You are walking a patient to the restroom when blood begins to drain from the surgical incision on his left arm. You have on gloves and have called for the nurse. What do you do next? A. Add bulky dressings to reinforce blood-soaked bandages. B. Apply direct pressure with a sterile dressing or clean towel. C. Wait for the nurse and do nothing. D. Quickly return the patient back to the bed. The correct answer is B. Apply direct pressure with your gloved hands. Remain calm and reassure the patient that the nurse will be there quickly. Once the nurse arrives, assist the nurse by gathering additional wound care supplies, helping to get the patient back in bed, and by also obtaining a full set of vital signs. We hope that you enjoyed this video. Please like the video and subscribe to Florida Training Academy's YouTube channel to be notified of our new CNA exam prep videos.